amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe. Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Сюда? Сюда. 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 Это, короче, типа обезболивающее.
Great. Now we'll wait a few minutes for the toe to get numb.
Так вот, о чем я говорил. Скоро количество просмотров 100. Я обязательно запилю ролик.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to... First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown. Great. Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze. That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Ребят, я хирургом никогда не буду.
Finish by applying some antibiotic ointment on a sterile.
Мазь какую-то намазывают змейкой.
Place it against the toe and wrap it in a gauze bandage.
Ребята, а еще если вы мне, подскажете программку.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper-fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Но так как выпуск получился слишком маленький, я предлагаю сыграть в игру симулятор зубного. Так вот, сейчас подкорректирую вам. Я вам, ребят, обязательно дам ссылку на одну из этих игр. И по одной игре вы, то есть, проходите одну игру, переходите на другую. Я думаю, вы поняли.
Welcome to Surgery Squad's Virtual Dental Crown. I'm Dr. Jeff, and I'll be assisting you with this procedure today. A dental crown is a tooth-shaped cap that is used not only to restore the strength and functionality of a tooth, but can also improve its overall appearance. Before we begin, let's review the types of crowns used in dentistry. First up, temporary crowns. Temporary crowns are placed over a patient's tooth while they wait for their permanent crown. They're usually prefabricated and made of plastic or stainless steel. A patient's permanent crown can be all metal, porcelain fused to metal, all porcelain, or all ceramic, each with their own advantages and disadvantages. Click on the different types of crowns to learn more about them. When you're ready to move on, our patient came in today with a broken tooth, courtesy of a freak softball accident. And we get the rewarding task of placing a crown in. If you haven't noticed already, it's one of their lower front teeth, tooth 23. Let's review what we're going to do today. To begin, we'll numb the tooth, then shape it, take impressions for our dental lab, place a temporary crown, and determine the shade of the tooth. When our patient returns for their next appointment, we'll place their permanent crown. Now, let's put on our gloves and get down to business. First, place some topical numbing gel on the injection site. This will alleviate any pain or... Now we need to inject the local anesthetic. After it has taken effect, the area around the tooth and the patient's lower lip should be numb for a few hours. Inject the local anesthetic in. Let's wait a few minutes to allow the anesthetic to set in. Now that the area has become completely numb, we can move on to preparing the tooth. To begin, we'll reduce the size of the tooth, cutting it away from the adjacent teeth. Go ahead, give it a try. It looks good, but we need to create a more tapered top to the tooth. This will allow for a more comfortable and exact fit for both the temporary and permanent crowns. That'll do. Now that the tooth has been shaped, we'll need to take impressions of our patient's teeth. This is done by placing impression trays into the mouth and having the patient bite down on them. These trays are filled with a putty-like substance that is generally referred to as impression material. The impression material is used to create a plaster cast and is then sent to our dental lab, where a dental technician will make the patient's permanent crown. Go ahead and make the impressions of our patient's teeth. When you're done, I'll have my dental assistant create the plaster cast and send it to the lab, where the magic happens. Excellent work. My dental assistant just informed me that our patient would like an all-porcelain crown on the tooth. So before we can finish up with them for the day, we need to determine the shade of porcelain that resembles their natural teeth. Can you handle this? Are you colorblind? That doesn't match at all. Are you? That looks like a match. The last item on today's agenda is to place the temporary crown. The temporary crowns that we use are prefabricated and made of plastic. I've already lined the inside of the crown with the temporary cement, so go ahead and place it on the prepared tooth. Since it's only a temporary crown, there are some guidelines our patient will need to be aware of before they go. They need to avoid sticky and hard foods. Try not to chew using the temporary crown, and steer clear of flossing on either side of the temporary crown. By flossing around the temporary crown, our patient may unintentionally pull the crown off the tooth. Well, we've done all we can do today. Our patient will need to come back in a week to have their permanent crown placed.
Ребят, наверное, сейчас вылезло такое окошко. Ну, типа там удалить, копировать.
Welcome back. Our patient has returned and is ready to have their permanent crown put on. Begin by using the dental hemostat to remove the temporary crown that we placed on the tooth last week.
Когда пройдете ее, сможете перейти на другие игры. Чем, пломбу, что ли, доставать будем?
Now use the Explorer to remove any excess temporary cement and debris. I've already checked the fit and color of the permanent crown, and everything seems great. I've applied cement on the inside of the crown, so it's ready for you to place.
Опять пломбу ставим.
Perfect. After the cement has hardened, the dentist would check the fit of the crown again, and the patient's bite, to ensure that there are no issues. Luckily for our patient, you did a marvelous job. After placing the permanent crown, our patient may notice some mild sensitivity for the first hour. Their dentist will also offer them some post-case recommendations to follow before they leave. This includes waiting at least an hour before having anything to eat or drink, and waiting 24 hours before enjoying their favorite sticky or chewy foods. If our patient has any pain or sensitivity when they bite down, they should contact their dentist immediately. This may indicate that the crown is too high on the tooth and needs to be adjusted. Most dental crowns last anywhere between 5 and 15 years, depending on normal wear and tear, oral hygiene habits, and other behaviors, such as teeth grinding, chewing ice, or biting your fingernails. Well, I hope you've enjoyed placing a dental crown. Maybe you should consider a career in dentistry. While you're at it, check out other great surgeries here at surgerysquad.com.
Поиграете, да и видео рассчитывалось на минут на 5, наверное, на 10, а оно уже 12. В принципе, с вами был Неликс. Увидимся в новых видео.